This presentation is on psychopathy. However, before we can begin our discussion of psychopathy, I find it important to provide some brief opening remarks. The first being that psychopathy to this day is still widely misunderstood. Additionally, psychopathy is extremely complex and multifaceted. And lastly, there is a considerable amount of controversy surrounding the topic of psychopathy. Some examples of this controversy are whether or not it can be defined as a personality disorder, or whether it can be technically diagnosed, and so on and so forth. So because of this, when we take all of these things into consideration, we see that there is an inevitable level of inconsistency regarding contemporary literature on psychopathy. Thus, as I view it, a considerable amount of setup is in order to best understand psychopathy to the extent that contemporary research allows us to. Thus, in order to make this presentation more accessible to a general audience, I have designed it to provide what I believe to be certain prerequisite information in chronological order that might be helpful in aiding in the understanding of psychopathy. So first, I will start by providing a brief overview of the DSM-5, and then I will move on to talking about personality disorders. After that, I will talk about a specific personality disorder known as antisocial personality disorder, and then I will move on to talking about psychopathy. After that, I will touch on the dimensions of psychopathy, as well as the notion of successful versus unsuccessful psychopaths. And then I will go on to talking about the overlap/differences between psychopathy and ASPD, and then I will touch on some causal factors and move on to discussing contemporary treatment options. After that, I will note some of the controversy surrounding the diagnosis of psychopathy, and I will conclude this presentation with some concluding remarks. And lastly, as always, the sources will be at the end of this presentation. So our first piece of sort of prerequisite information that will help us or aid us in our understanding of psychopathy is understanding what the DSM-5 is, or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. So the DSM-5, put simply, serves as a medical reference book for experts and professionals, and the DSM-5 covers topics such as brain-related conditions and disorders and mental health. Additionally, it was written, edited, reviewed, and published by the American Psychiatric Association, and it has multiple uses. However, one popular use is that it helps professionals diagnose certain conditions. And in doing so, the DSM-5 is able to help by providing clear and highly detailed definitions of mental health and brain-related conditions. Additionally, the DSM-5 also provides details and examples of the signs and symptoms of those conditions. So moving on then, the DSM-5 recognizes certain disorders known as personality disorders, and understanding what personality disorders are will be relevant to our understanding of psychopathy. And this is because there is controversy regarding whether or not psychopathy is a personality disorder, and psychopathy shares a noticeable amount of overlap with another personality disorder. So turning our attention back to personality disorders, we need to understand exactly what psychologists are referring to when they say the word personality. And personality refers to the enduring characteristics and behavior that compromise a person's unique adjustment to life. So things that typically make up an individual's personality, such as their coping styles, ways of socializing, and characteristic traits, typically appear when they are a child. However, by the time they are in early adulthood or adolescence, the things that make up this individual's personality typically become solidified patterns. However, the way that an individual's personality develops, to put it in the simplest of terms, can develop in a way that's either extremely maladaptive or adaptive. However, to define it more in the more formal terms, personality disorders, as defined by the textbooks, are a gradual development of inflexible and distorted personality and behavioral patterns that result in persistently maladaptive ways of perceiving, thinking about, and relating to the world. So it's commonly seen in individuals who are experiencing or living with personality disorders that they experience interpersonal difficulties, as well as problems with their sense of self and their identity. And lastly, they show an inability to function adequately in a said culture society. So a little bit more on personality disorders. They first appeared in the DSM in the year 1980, and the DSM-5 recognizes a large number of personality disorders, and these disorders are organized by grouping them into 3 clusters. And the clusters are based upon things that were supposed to be important or similar traits or features of these disorders at the time, which I will go into more depth on the following slide. So pictured here are the personality disorder clusters that are in the DSM-5, and I'll go over them very briefly. So in cluster A, we have paranoid, schizoid, and schizotypal personality disorders. So individuals who can be categorized by having disorders in cluster A typically display odd and eccentric, distrustful, suspicious, and antisocial traits. And in cluster B, we have histrionic, narcissistic, antisocial, and borderline personality disorders. Cluster B is characterized by dramatic, emotional, and erratic traits. And lastly, in cluster C, we see avoidant, dependent, and obsessive-compulsive personality disorders. And individuals that are categorized by having cluster C personality disorders typically display fearful and anxious traits. Now, you may have noticed that psychopathy was not in any of the previous clusters. And this is because the DSM-5 does not recognize psychopathy as a personality disorder. Instead, they only recognize ASPD, or antisocial personality disorder. And this is where I believe some of the controversy and confusion surrounding psychopathy that I noted earlier stems from. So understanding what ASPD is will help us remedy that confusion and ultimately aid us in understanding psychopathy better. So ASPD is defined as a disorder characterized by continual violation of and disregard for the rights of others through deceitful, aggressive, or antisocial behavior, typically without remorse or loyalty to anyone. So some of the diagnostic criteria for ASPD states that individuals must be over the age of 18 in order to be diagnosed. Additionally, they must have shown symptoms of conduct disorder before they were the age of 15. And to take it one step further, the criteria states that after the age of 15, they must have engaged in the following: repeated unlawful behavior, deceitfulness, impulsivity, aggressiveness, and consistent irresponsibility in work and financial matters. So the DSM-5's criteria for ASPD that's pictured on the screen at the moment is far more rigorous than what I have noted in the previous slide. However, for the purposes of time, I can't read through it, but I will leave it up on the screen for a few moments just in case anybody would like to pause it and familiarize themselves with it. Alright, now that we've gone over all of the prerequisite information, we are ready to discuss psychopathy itself. So the textbook defines psychopathy as a condition involving the features of antisocial personality disorder, as well as such traits such as a lack of empathy, inflated and arrogant self-appraisal, and glib and superficial charm. So for a brief history of psychopathy, it was first identified during the 19th century. However, at the time, it was far less understood than it is now. And around that same time period, it was also known as sociopathic personality disorder. However, in the 1940s, a huge breakthrough was made when Cleckley, an American psychiatrist and prominent figure in the area of psychopathy, authored his book known as The Mask of Sanity. And in his book, he included the earliest comprehensive description of psychopathy by providing 21 characteristic traits of psychopathy that were later reduced to 16 and are still used to this day. So you may be more familiar with psychopathy than you think you are. And this is because psychopathy is typically displayed in Hollywood serial killer films. However, the portrayals are oftentimes exaggerated and don't typically display the complexity as well as all of the dimensions of psychopathy. So an example of this would be that not all psychopaths engage in violent behaviors like the character Michael Myers pictured to the left from the popular movie franchise known as Halloween. Instead, psychopathic traits can manifest in a plethora of ways, which leads us into our next slide. So pictured on the screen is a psychopathy checklist revised, or a tool to help diagnose psychopathy. And researchers state that the best way to understand psychopathy is to address all of the dimensions pictured here. Although it's important to mention that different sources organize the PCLR, or the Psychopathy Checklist Revised, in different manners. However, the textbook specifically notes that at an earlier point in time, what is now known as the interpersonal dimension and the affective dimension of psychopathy were once grouped together and referred to as Factor 1, and likewise with the lifestyle and antisocial dimension, which were referred to as Factor 2. Thus, the flowchart here calls upon both methods of organizing it. So if we turn our attention to what was once known as Facet 1 of Factor 1, we see what is now known as the interpersonal dimension, and it notes characteristic psychopathic traits such as glibness and superficial charm, a grandiose sense of self-worth, or a really exaggerated idea of how important they are. We also see pathological lying and being manipulative and conning people. So looking at Facet 2 of Factor 1, or the affective dimension, we see a lack of remorse or guilt in these individuals, or typically they wouldn't feel bad, to put it in the simplest of terms, for things that the average person would. For example, robbing an old lady. The average person would feel really guilty for that, but these individuals wouldn't really feel anything at all. And this is because they show shallow affect, and they're also callous and lacking empathy. Additionally, they also show a failure to accept responsibility for their own actions. So moving on to Facet 3 of Factor 2, or the lifestyle dimension, we see a need for stimulation as well as being prone to boredom. We also see a parasitic lifestyle. An example of this would be a psychopath marrying someone that they felt nothing for simply because they wanted to use some of their assets, such as their house, their car, or have access to their money, and things like that. Additionally, we see a lack of realistic long-term goals, as well as being impulsive and irresponsible. And lastly, in facet 4 of factor 2, or the antisocial dimension, we see poor behavioral controls, early behavioral problems, and juvenile delinquency. Additionally, we see revocation of conditional release and criminal versatility, or committing various different types of crimes, such as arson, violent crimes, and so on and so forth. So because psychopathy is so multidimensional and psychopathic traits vary in nature and severity, it has led to the notion that different types, for lack of a better word, of psychopaths exist, or more specifically, that there are successful and unsuccessful psychopaths. So diving deeper into the notion of successful versus unsuccessful psychopaths, research suggests that some individuals with psychopathy might be able to use certain traits to their advantage and change their lives for the better. An example of this would be that a successful psychopath, so to speak, might be able to tap into certain traits such as charm and use them to charm their way into leadership positions, such as a CEO, while an unsuccessful psychopath might end up in prison. So then it begs the question, how are some psychopaths successful while others are not? And it's thought that the difference between successful and unsuccessful psychopaths is that successful psychopaths have more intact information processing. Additionally, they're thought to have greater conscientious traits and a better control of their impulses. A quote supporting the notion of successful versus unsuccessful psychopaths by Robert Hare, a respectable researcher in the field of psychopathy, reads that not all psychopaths are in prison, some are in the boardroom. Moving on. Now that we understand a little bit about both ASPD and psychopathy, we can address some of the controversy regarding whether or not psychopathy is its own personality disorder. So to start, it depends on which source you consult, but I believe that a fair amount of research supports that ASPD and psychopathy are similar, but not the same. Turning our attention to the differences between ASPD and psychopathy, we see that ASPD is recognized by the DSM-5 as a personality disorder, however psychopathy is not. Additionally, ASPD has been well studied amongst the overall population, whereas psychopathy is typically only studied amongst prison settings. So the prevalence of ASPD is estimated to affect about 2 to 4% of the general population, whereas psychopathy we don't really know for sure because no epidemiological studies have been able to gauge it. However, it's estimated that the prevalence affects about 1 to 2% of males in North America, and it affects about significantly less than 1% of females. Moving back to ASPD, we see the diagnosis for ASPD is far more broad, focusing on certain things such as behavioral criteria. And the diagnosis for psychopathy is far more narrow, focusing on certain things such as the individual's personality structure. Turning our attention to the similarities between ASPD and psychopathy, we see that they share similar traits, and some of these traits are aggression and a lack of remorse. And we also see that they can be thought to be caused by the same risk factors, or in other words, that they can be thought to be caused by genetic and environmental risk factors, which we'll go into more depth in the following slide. Moving on to risk factors and the role they play in the development of conditions/disorders, we can ask ourselves what causes psychopathy. But the cause of psychopathy is unknown. However, it's thought to be complex and involving various types of risk factors. Focusing on genetic risk factors specifically, though, contemporary science supports the idea that there is not a single gene responsible for psychopathy. Rather, it's thought that multiple genes can increase an individual's risk in developing psychopathy. Because of this, psychopathy is thought to be hereditary, or in other words, some individuals are thought to be more genetically inclined to develop psychopathy than others. So scientists are conducting research on a specific gene that's believed to potentially aid in the development of psychopathy, known as MAOAL, or also known as the warrior gene. And this gene has been linked to an increased risk of aggressive and violent behavior. Moving on to environmental risk factors, they are thought to either increase or reduce the risk of developing psychopathy, and some of the risk factors are smoking during pregnancy, high stress levels during pregnancy or birth complications, as well as that individual not experiencing a highly warm and responsive parenting style in their early childhood. And lastly, we also see a fearless temperament. However, these factors are thought to only affect the risk of developing psychopathy very minimally. Moving on to another potential cause or risk factor of psychopathy, we see differences in neurobiology. So it's thought that genetic and environmental influences are not the direct cause of psychopathy, rather they influence or change the way the brain develops in specific ways, such as the development of certain brain structures and circuits. For example, one difference is the reduction of the amygdala, or the area of the brain associated with emotion and fear conditioning, and when this happens, it's thought to interfere with the individual's moral development and socialization. Additionally, deficits in the prefrontal cortex, or the area of the brain associated with behavioral control and decision-making, are thought to cause emotional and behavioral disturbances. So then, how is psychopathy treated? Well, contemporary treatment options have not proved to be very effective, with far more cons than pros. So it seems as if an appropriate place to start is by listing the cons. The first being that psychopaths aren't typically under the impression that they need to seek treatment. However, when they do seek treatment, they can take advantage of certain treatment programs and the skill sets that the programs focus on in order to become better at charming and manipulating people. An example of this would be taking advantage of treatment programs that focus on improving social skills and empathy. Additionally, no pharmacological treatments have been effective yet, but even if they were, the problem still stands. Psychopaths don't commonly believe that they need treatment. And lastly, CBT treatments produce subpar results at best. So moving on to the pros. We see that CBT methods are at least slightly more effective in younger patients than they are in older patients. Additionally, some professionals think that it's possible to convince psychopaths to use certain characteristic traits such as charm and manipulation to get their needs met ethically. And lastly, burned out psychopaths exist, or psychopaths who show a decline in prototypical psychopathic traits, perhaps due to reduced biological drives and a lifetime exposure to social conditioning, and so on. And lastly, I would be remiss if I did not address the controversy surrounding the diagnosis of psychopathy. Because the DSM-5 does not recognize psychopathy as a personality disorder, some individuals think that you can't technically get a diagnosis for it. As a result, professionals must use the diagnostic criteria for ASPD. However, when this happens, problems arise because ASPD doesn't adequately capture all of the features of psychopathy. Although at one point the DSM-5 task force spoke about updating the diagnostic criteria for ASPD in order to encapsulate psychopathy. Unfortunately, no changes were made. Instead, an alternative approach to the diagnosis of ASPD was added to Section 3 of the DSM-5 with an emphasis on pathological personality traits. Unfortunately, many researchers still use the PCLR diagnosis instead of using the DSM-5 ASPD diagnosis, thus increasing the overall confusion and controversy surrounding psychopathy. All in all, a general consensus needs to be reached. As you can see, there's a considerable amount of controversy and inconsistency regarding contemporary literature on psychopathy. Thus, more research needs to be conducted in order for us to fully understand psychopathy. Listed here are the sources I've used for this presentation. Thank you for watching.